Okay, let's dive into diabetes mellitus, one of the world's most common chronic conditions.
So, at its core, diabetes is all about the body's struggle with insulin and how we use energy. But here's the thing, it's not just one disease. It really boils down to two main variations.
What's the real difference? Type 1 is no insulin. Type 2 is when insulin just doesn't work right.
And just look at the scale of this. Type 2 diabetes, that's about 90 to 95% of all cases.
And it doesn't stop there. You've also got other types, like gestational diabetes during pregnancy.
All right, so how do we treat this? Well, for many, it all starts with insulin therapy.
Think of insulin as a key. It unlocks your cells so they can absorb sugar from the blood. But it's a real balancing act. Too much insulin can cause dangerously low blood sugar, or hypoglycemia. For type 2, though, we've got a whole lot more in our toolkit beyond just insulin.
First up is metformin. It's usually the first drug prescribed and helps your own insulin work better.
Then you have sulfonylureas. These basically just tell the pancreas to make more insulin. TZDs are all about boosting insulin sensitivity, especially in your muscle and fat tissue.
Now for a clever approach. These drugs work with your gut hormones to help manage blood sugar.
And these are really different. They actually make your kidneys get rid of extra sugar through your urine.
So with all these choices, how in the world do doctors pick the right one for a patient?
Well, it's a careful trade-off. They look at the risk of low blood sugar versus the impact on weight.
And looking ahead, it's all about personalizing this. How can we tailor treatment for each individual?